This video will demonstrate the technique and tips and tricks of performing an arthroscopic dorsal scapular neurolysis. Patients are positioned in a lateral, semi-prone decubitus position with the arm behind the back. The entire scapular border is delineated, as well as the rhomboid major and minor, to determine the soft spot and best entry site of the arthroscopic cannula. The dorsal scapular nerve is classically described as coursing through its thoracic segment approximately 1 to 3 centimeters from the medial border of the scapula, and this may also be marked. Visualized in this still are the three main portals of this procedure: a distal viewing portal, and then two proximal working portals medial to the expected course of the dorsal scapular nerve. The dorsal scapular nerve in its thoracic segment is most reliably found proximally adjacent to the supromedial border of the scapula. It is intimately related with the vascular pedicle, the dorsal scapular artery and vein, as depicted here. It courses on the undersurface of the rhomboid major and minor, superficial to the fascia, which may cause entrapment. Once found, the nerve is freed with careful electrocautery as well as mechanical dissection. Occasionally, there are bridging veins which may require ligation with either, again, electrocautery or with hemoclips. As shown here, careful electrocautery is used to free the nerve from its fascial segment. This is adjacent to the supromedial border, and immediately to the right is the arterial and vascular pedicle. There is frequently perineural fat around the dorsal scapular nerve, as visualized here on the left. To the right is the dorsal scapular artery and vein. We frequently also perform a supromedial border resection in this circumstance. We perform a dynamic assessment after we've identified the nerve and vessels to determine if there is any potential impingement of the supromedial border on these structures, as seen here. Once we have resected the supromedial border, we again perform a dynamic assessment with the arm in various positions, and again here we see that there is no longer compression on the pedicle or the dorsal scapular nerve structures.